Thank you for your time. I'm joined with some of my colleagues today who may well chip in if I go off track. But I have three short slides to share with you. So thank you for your time. Firstly, to introduce Kids Operating Room. I think that we are now arguably the leading global surgery charity. We're certainly a trusted partner of ministries of health around the world. We have opened 75 operating rooms in 27 countries. So we've a pretty good idea of how to build an operating room, how to do so, regardless of the context. And we give about 45,000 children a year with access to safe surgery. But what matters isn't so much the operation. It is like this child who received an operation in the world's first ever operating room in a refugee camp dedicated for children, is that he wanted to go to school. And this work enables children to go to school, and it enables mothers to go back to work. And actually, every 12 minutes, another patient will have life-changing surgery in one of our facilities somewhere in the world. And it doesn't matter if you're a child or an adult. Surgery has a key role, particularly in cancer, not just in the treatment, but also in the diagnosis. And so surgical services are vital to the development of safe surgical services. And if you're looking at a women's oncology service, then you cannot do that without surgery. I'm going to stop talking about Kids Operating Room, though, because I want to talk about Global Hospital. Global Hospital is a company that is owned by Kids Operating Room. It provides engineers, it develops and installs solar systems for hospitals, and it creates healthcare infrastructure. And that allows Kids Operating Room to have a blended finance model whereby profits from Kids Operating Room don't go off to shareholders. Instead, they get reinvested. So whether we're building a geriatrics facility or a women's health facility, there will also be a spin-off benefit for children's health too. Can I have the next slide, please? So looking then at Global Hospital, and just picking up on that last point around metrics, we do partner with Yale and with UCSF, show real world impact. So yes, children go to school, but mothers return to work, and death and disability are prevented. And so that allows us to start to put an economic value on providing a patient with an operation. And we're able to say that all of our data, which is now probably one of the world's largest databases on the provision of general surgery, suggests that the value of a single operation can be assessed, and is about $36,000 in economic benefit for the host nation. And when we look at an example of end-to-end women's health costs, it is not prohibitively expensive to develop surgical services. Going to somewhere where there is really nothing and we need to put in place the people and the infrastructure, you can do all of that, including training 2 local engineers and putting in place a service and maintenance program for about $975,000. And we've got pretty robust experience of doing this, and we can say that that is a very reliable figure that you could use to plan surgical service development. And in getting to this stage, we have benefited from technical assistance hugely, and we continue to do so, and always welcome those opportunities. But open to looking at those investment opportunities in this kind of work as well. And maybe if I could just have the final slide, please. So, Prof. Roma, you mentioned the interest in enhancing ambulatory care. And of course, absolutely vital, but there has to be something in the hospital for when that patient arrives. And that's really where we exist in Global Hospital, because we have that skill and experience of developing infrastructure. And so we've carried out a national demographic review. We've coupled that with a literature-based epidemiology evaluation. Of course, it is for the Zambians to say what they want, but we try to give an informed opinion of what could be done. we felt that a nationwide women's oncology infrastructure investment was possible. You might consider creating kind of 5 national centres of excellence. You would enhance the clinical workforce. You would deploy solar surgery systems into these hospitals. And you could do that in a way that wasn't gigantically expensive, but that had real significant impact. We felt that 30,000 patients could be seen in 3 years. We felt that we could evaluate the value of that to about 1.1 billion economic dollars of new GNI for Zambia if you made that investment. And arguably more importantly than that, you would leave a legacy of skilled jobs, you would have strengthened the economy, you would have treated patients with dignity and respect and quality, you would have restored families, and you would have left a legacy of decades worth of care yet to be given in the facilities that you've created and the people that you train. So the impact is definitely there. The opportunity is huge, and Zambia seems like exactly the right place to be making that investment. So thank you.